Hello everyone, welcome to Scardia.com once again. I am your educator Dr. Lara Munir, and today we are going to discuss a few urinary abnormalities. Since this is a very exclusive and a big topic and it encompasses a lot of concepts, we have divided this lecture into two parts. This is the first part of the lecture in which we are going to primarily discuss azotemia or the renal failure. So let me give you an outline of how we are going to proceed. It's always good to start off with the basics. We're going to look at or revise the anatomy of the nephron, the various physiological processes that can occur, the blood supply of the kidney, and afterwards, when we have refreshed our basics, we are going to delve into the main topic of discussion today, which is azotemia or acute kidney injury. We are going to define what is azotemia. Then afterwards, we are going to classify it into the various types, whether it is pre-renal, it is post-renal, or whether it is renal or any pathology involving the kidney. Afterwards, what are the various markers that can help us in identifying the various types of azotemia? A very important marker is the BUN and creatinine ratio. And we are going to explain what are the different changes occurring in the BUN and creatinine ratio. To start off, we are going to discuss how a normal glomerulus responds and what are the normal findings in a person who has perfectly fine kidneys. And then proceeding further, with the help of various illustrations, we are going to discuss the changes occurring in the patient with prerenal azotemia or in a patient with renal azotemia, and how do the BUN and creatinine ratio help us in differentiating the two, or whether this patient has some obstruction causing the post-renal azotemia, and what is the BUN and creatinine ratio in that patient. After the discussion of the BUN and creatinine ratio, we are going to discuss how we are going to approach the patient with the help of what are the various diagnostic procedures we can do, like renal ultrasound, what are the various findings on the renal urinalysis, which helps us in identifying whether there is some abnormality occurring inside the kidney, or whether this abnormality is related to some pre-renal cause, which is causing the symptoms of renal failure. We are going to define terms like oliguria, what is the cutoff value of oliguria, what are the various pathophysiological mechanisms that can lead to oliguria in patients. And afterwards, if the kidney pathology is severe enough to cause a renal shutdown, or the patient is unable to produce some urine for the last 24 hours, then that is classified as anuria, and this can become a medical emergency as well. And then we are going to look off at what can be the major causes of this acute renal shutdown or anuria in this patient, whether they are pre-renal, they are renal, or whether they are post-renal causes. So, to watch this complete lecture and thousands of other similar lectures on various medical topics, like you can have a plethora of discussion here on anatomy and the basic sciences of physiology, or if you are in your advanced years of medical course, you can have a very good you can find some very good content here on internal medicine or surgery or gynecology. And similarly, these lectures are also very helpful for the practicing doctors to refresh their basics, or if they find themselves lacking in certain parts of certain disciplines of medicine. So feel free to start your free trial today on Scardia.com, and I'm your educator, Dr. Lara Munir. I'll see you in another lecture.